to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome today Dr. Dr. Edney. You are the President of Tidal Health Peninsula Regional Medical Staff. Very important job. And you are here today to address an important issue that's affecting our community at the current time, and that is that elective surgeries have had to be suspended at the hospital, partly because we also want to talk about COVID and the vaccine and that type of thing, because that seems to be the source of the problem. So I'll let you take it from here in terms of describing why this is happening and so forth.
Great, thanks Mary, and thanks for having me back. I really appreciate the opportunity to have this discussion with you, and so again we can continue to put information out to the local public about what's going on in our region, at our hospital with this. And so you alluded to it, we've made the difficult decisions as of yesterday to suspend and delay non-urgent surgeries, or so-called elective surgeries. Those surgeries that would require someone to spend a night or two in the hospital afterwards. We're still doing surgeries that you go home the same day from, and that's a critical distinction. But if people are facing elective surgery, and these oftentimes are things like knee replacements, hip replacements, hernia surgery, although oftentimes those go home the same day. There are various types of surgery, abdominal surgeries, that require 1 or 2 nights in the hospital. Those are being put off. A lot of vascular surgeries actually require a couple nights in the hospital. They're being put off, and for a couple key reasons. Our hospital is under a tremendous amount of stress with respect to when you compare the resources we have, both the people and the space and everything that goes into caring for the community, compared to the numbers of people that are presenting for care. It's at the point of saturation where we're at our limit of being able to safely care for the numbers of people that we need to care for, and there are 2 key reasons for that. Number one, we locally are experiencing a phenomenon that's going on across the country. We're not unique, but there's a countrywide shortage of nurses. And the reason for that is multifactorial. A lot of nurses have decided to leave the profession in the last several months. Again, for a few different reasons, but chief among them, chronic stress of having worked in this COVID environment for so long. We're 18 months into this thing. And taking care of patients over that long term, as sick as they get, and with the deaths that occur and the challenges associated with that, it's extremely stressful. And so a lot of nurses have made the decision to either work in a different nursing environment or leave nursing altogether. And that's created some significant shortages. And so going into this COVID surge, we were short on nurses, and we're doing a lot of work as a health system to try to improve and support that shortage and make sure that we've got appropriately trained nurses at the bedside, and we're keeping up, but barely. And the other significant stress that's been brought on the system is huge numbers of people again being admitted sick with COVID. What's different this time, Mary, is that the folks who are being admitted are the unvaccinated. We've had a vaccine now since the beginning of the year. And those who have been vaccinated are largely protected. Can you get COVID infection if you've had a vaccination? Yes, you can get it. But what we know about vaccination is, number one, that it's very safe. And 2, it protects you from getting sick if you get infected, even after having gotten the vaccination. So we're seeing a lot of people who have chosen, for various reasons, to not get vaccinated, getting the virus, getting sick enough with the virus to now require hospital admission. And so we add that stress of those folks needing to come in and be admitted to the floor, and sometimes to the intensive care unit. And that combination of factors has combined to put significant stress on our system. And so we've had to pause these elective surgeries to allow to keep the beds open for the people that are coming in through the emergency room that are needing this level of care. And it's always a very difficult decision to pause elective surgeries, because no surgery is truly elective. I mean, these people aren't raising their hands saying, I want surgery for fun. They're doing it because they have a real medical need. And there are actually real concerns. The longer you put off a surgery that you need, other things can start to happen. And so we are very carefully selecting ones that can safely be put off for 2 or 3 weeks. Right now we've chosen a 2-week time period in which we're going to do this suspension. This is going to be constantly reevaluated. We on a daily basis, we are looking at information that we have. We have dashboards of information that are produced by Sarah Arnett's our Chief Nursing Officer. She does a phenomenal job of keeping us updated on bed occupancy rates, ICU capacity rates, but also nursing levels in each of the clinical areas, the medical surgical floors, the ICU, the emergency room, and a variety of other staffing levels that are critical in helping us understand at what point can we safely remove this suspension and get back to normal business. We believe me, we want to get back to normal business as soon as absolutely it's safe to, and we're reviewing it on a daily basis. But that's what's going on at the hospital. That's why we're in the situation we're in. And I appreciate the opportunity to let folks know that and to have this discussion about what folks can do to help, because there's a lot that folks can do, particularly folks who aren't vaccinated.
Right, and I know just in this area, I mean, the state of Maryland has a fairly high rate, correct? At least 75% have gotten one shot. It's Wycomico County, Worcester, Somerset, they're all in the 40s range.
That's right. Here on the lower shore, we do lag behind state levels. State levels are 75%, as they are nationally. But here on the lower shore, the Wycomico County rate, last I checked from our health department, was around 45%. And when you look at Worcester and Somerset County, again, hovering right around 50%, give or take, vaccinated. So significant number of people who have chosen, for a variety of reasons, to not get vaccinated. So it's those folks, some of them, who are getting sick. And again, the virus still tends to make people sicker who have underlying, what we call comorbidities, underlying health issues that make them more susceptible to getting sick. And the big ones that we see are being overweight and obesity, and it's an independent risk factor for getting sick with COVID. So if you're carrying a fair amount of extra weight, you're high risk if you get COVID for getting very sick with COVID. Mm-hmm. So that's one thing. But there's heart disease and there's diabetes and immunocompromised people who have reduced function of their immune system, either from disease or from having had chemotherapy, for example. A variety of other folks who are considered high risk. The elderly, just being of advanced age is an independent risk factor for getting sicker with this disease. And so especially those high risk populations, the recommendation is if you're not vaccinated, please get vaccinated. And I understand a lot of people at this point who haven't gotten vaccinated are very dug in to their choice. And they've made a decision and they've sort of closed themselves off to additional information. And I understand their frustration because there are a lot of mixed messages coming from government sources, government sources that historically we felt like we could trust, like the CDC. Right. That seems like every other week it's changing its story and flip-flopping. And there's just, and the internet is full, as you know. If you get on the internet, you get on these tangents. There's a tremendous amount of misinformation on the internet, conspiracy theories, all sorts of things. So people can be forgiven for being confused. It's a confusing circumstance, a confusing scenario with lots of different competing sets of information being presented. What I would ask folks to do, however, is to continually process information. One of the mistakes we make, I think, in making decisions, particularly in times of stress, is to shut ourselves off from new information. I would urge folks, even if you're dug into your decision, you've made a decision, the vaccine's not for you, you're not doing it, please continue to process new information. And you may process that information and still come to the same decision. That's fine, but that's better than closing yourself off to new data, new information as it comes out. Because I think you will find that over time, a lot of this cloud of uncertainty will start to clear. And what's going to emerge from that is, at the end of the day, the notion that this vaccine is safe. And in fact, it does prevent you from getting sick with COVID. It doesn't prevent all instances of COVID. It prevents you from getting very sick with COVID. And locally, again, just from a purely pragmatic standpoint, regardless of the reason that you've decided not to get COVID, the fact remains the vast majority of people needing to come into the hospital because they're sick enough with COVID to require hospital care, 90% of them, 90% are unvaccinated. And so my plea is for the unvaccinated folks to please take another look at your decision. The vaccine is safe. Please consider it. And again, I know unfortunately, this has become a very politicized issue, and people are extremely dug in on political sides, and each political side kind of extracts the data that it likes and uses it to make its argument. That's what politics is, and that's our system. I understand that. But from a pragmatic standpoint, your local hospital system is under a tremendous amount of stress, and there actually is something the community can do, which is, if you're not vaccinated, to please consider getting vaccinated.
I know one way I've thought about it is early on I could understand people's hesitancy. You know, it was new. And a lot of people still don't understand that the mRNA technology that was used to develop the vaccine has been around, 10, 20 years. It wasn't just a brand new thing. So yes, it's new, but now we're how many months in with vaccination and millions of doses given, and it's working, it's safe, it's effective. So you're right, you have to process the here and now.
Sure.
We have numbers now, to support the vaccine in terms of its safety and effectiveness.
Sure, you're exactly right, Mary. mRNA technology has been around for a very long time, and one of the common misconceptions about mRNA is it sounds like DNA, and in fact it's a relative of DNA, but it has a very different function than the DNA of the cell. And people get very sort of concerned when you start talking about DNA and the functions, kind of the blueprint of the cell. Don't mess with DNA. This mRNA virus actually has nothing to do with the DNA of the cells. It doesn't interact with the nucleus of the cell where the DNA lives. It goes into what's called the cytoplasm of the cell, which is the inner workings of the cell. And all mRNA does is code for proteins. And those proteins then float to the surface of the cell and allow your immune system to recognize what it thinks is a virus, but actually respond to an innocuous protein that doesn't cause you any harm. And that's how you get immunity. So yes, it's mRNA that's being introduced into your body. It doesn't touch your DNA. It doesn't interact with it. It doesn't change it. And so I think that's an important point, because it's a source of confusion for folks who aren't as familiar with the cellular chemistry of what actually is going on with the mRNA vaccine.
And it does have no relationship to impacting fertility. I know that's another common misconception.
Very common thing, especially on the internet, and there are a lot of sort of, quote unquote studies floating around. There is no high quality data to suggest that it has any detrimental effect on fertility. And this is, again, worldwide. When you look across Europe, who has, again, extensive experience going back to when the vaccine first became available, and a lot of the studies that were done, millions of women have been inoculated with no evidence that there's any undue risk to fertility.
So let's summarize some of the key information you'd like to say to our audience today.
Sure. So in summary, my main goal was to let our community know where we are as a health system, the stress that we're under, and why we're under that stress. And the COVID aspect of that is the notion that we have very low, comparatively low vaccination rates here on the lower Delmarva Peninsula. I understand that a lot of people have come to a decision not to get vaccinated, and the reasons behind that are varied. Part of that resistance, however, is a lot of misinformation that's out there. And so what I'm trying to do is and what the medical community is trying to do is provide good data where bad data has been sort of introduced and caused people to be wary and cautious. Provide the information that hopefully will help make people feel better, but also just to urge those who have dug in and said, I've made my decision, you're not going to convince me. Just a plea to continue to take in new information. Don't close yourself off to new information, because it is cloudy, it's messy, there's a lot of data, there are a lot of mixed messages about COVID, about the vaccine, about data coming from the government, from institutions like the CDC and other, historically trusted institutions are sending mixed messages. So people's confusion is understandable. At the end of the day, I want people to remember that just at a pragmatic level, again, not discounting your very strongly held beliefs and reasons for wanting to sit this one out, as a pragmatic matter, we know for a fact that those folks who are getting sick with COVID in our region, 90% of them, it's because they're unvaccinated. Yes, vaccinated people can get COVID. Not a lot of them do, but some do. But when they do, the vaccine protects them from severe illness, by and large. So those aren't the folks, by and large, coming in. 90% of the folks coming in are the unvaccinated. So just as a pragmatic matter, if you can get to the point where you can at least be reasonably convinced that this is a safe vaccine, and all of the medical evidence to this point suggests it's a safe vaccine, Are there adverse effects associated with it? Yes. Will people listening who have decided not to get that vaccine come up with, oh, I know so-and-so who got it and they had X, Y, and Z reaction? Yes, everybody's going to be able to cite one or two people that they know or have heard of that had an adverse reaction. We're not saying adverse reactions don't happen. What we're saying is the rate of adverse reactions is not different than most other vaccines, that by and large it's very safe, and it's hugely important for our community with respect to not only our community health, but to reduce the stress that's being put on our health system right now, requiring us to put off elective surgeries. These are people, members of our community, our families, our friends, our neighbors, who need surgery, who the hospital system is having to say, you need to wait because we're under so much stress in the hospital, largely from unvaccinated people getting COVID and requiring admission. Again, we do have this nursing shortage going on, so it's not the whole story, but it's a significant part of the story is unvaccinated people getting sick with COVID and requiring our help. And of course we're going to help those people. But there's something that they can do. There's something the community can do for those who have at least now come to the decision they're not going to have it. Please continue to process information. The world is not black and white. This is a messy issue. As time goes on, I think you will see, again, and I'm convinced that more and more people will be convinced that this is a safe vaccine. It's the right thing to do for themselves, for their family, and for their community.
I know I always felt like it was just our way out of this mess, after how many months of lockdown and, finally the vaccine was available and many people did go get it and have been the earlier test cases of how safe and effective it is. And it's about protecting the community. You're right, protecting our loved ones. I know I was concerned because I have some aging family members, and it's, to me, my nursing background, and I just think vaccines work, and for the most part, and they're safe and effective. And in the course of history, haven't they gotten us out of a lot of problems?
Absolutely. You look at the laundry list of infectious diseases that have been eradicated or significantly controlled by vaccines, and so absolutely, it's the best thing from a societal point of view to continue to engage in vaccines. And yes, this is a new formulation of a vaccine using mRNA technology, which has been around for a while, but it's the first application of mRNA technology to vaccines. But this is the beginning of the next phase of vaccinations going forward. There will be other mRNA vaccines because they're incredibly safe and incredibly effective. And so this is one of the great benefits to society that we will have had in this generation is that, together the production very quickly of an extremely effective vaccine with a good safety profile that will ultimately have saved millions of lives. But people need to avail themselves of the vaccine to get its benefit.
Well, Mark, thank you so much for coming on the program. I know you were anxious to come on to use this as another venue to get the message out about why elective surgeries have been paused and what maybe some of us can do to help, that haven't gotten the vaccine as yet, because that does seem to be the majority of cases you're seeing at the hospital. So thanks again, and we'll be in touch. We can perhaps do another show down the road, hopefully with better news and that we're moving forward from this.
Thanks, Mary. I really appreciate it.
And thank you for joining us for this edition of Focus on Health here on PAC 14.